You know, every so often a story comes along that is so horrifying the whole world stops to watch. And this is exactly one of them. Malala Yousafzai. She is the 15-year-old Pakistani girl who dared to speak up and out against the Taliban, declaring her right to go to school. For her bravery, she was shot point blank in her head by one of the gunmen. And we're happy to report today we have an update on her recovery. It is good news. Not only is she awake, and by the way, these are fresh pictures you're seeing of her right now. There's a lot more to tell you about. The world attention around her fight for survival has been so massive. The British hospital where she's being treated right now has set up this website. And if you want to go on, you can. It updates itself every few hours. Here's the latest. She not only is awake, she has movement of her arms and her legs, and she has managed to stand up. But her injury is so complex, so we brought in a neurosurgeon, Dr. Sanjay Dhall, to help explain. So welcome, and thank you for bringing this, because this just helps us, for those of us who are not neurosurgeons, really understand exactly what's going on. So let's begin first with Malala and just her. Where exactly do we believe the bullet entered her brain?
So our understanding from published reports is that
this is the front of the skull.
Yeah, so this is a model of the brain, and this is the left, and this is the right, and this is the front, and this is the back.
Okay.
And it sounds like the bullet struck right behind her left eye and grazed her brain, and when it did that, it fragmented and fractured her skull and sent many bone fragments into her brain, probably in this area. And then the bullet continued to travel down in her neck.
So that's part of the problem, though, to point out, is it's not as much the bullet as it is these fragments of her skull that are now in her brain.
Well, it's a combination of both. And really the injury that is suffered from a gunshot wound is not necessarily the bullet itself, but the high speed at which it's traveling. And it carries a tremendous amount of energy, and it creates this shock wave that shatters both the skull and the brain around it, and it literally creates a shock wave that passes through and cavitates or destroys large amounts of brain around where the bullet is traveling.
But Sanjay, the fact that she's not speaking, she has tubes, but she's able to write full sentences, and she can stand. How is that possible 10 days later, especially when we're talking left side of the brain, because doesn't that control, I know not speech, but just communicative skills?
It absolutely does, and it's really phenomenal considering that she was shot at point-blank range with probably a very high-caliber, powerful weapon, and that she survived it all, not to mention that she's made such a remarkable recovery.
10 days later.
Right, and what may have happened is that she was fortunate in that it was somewhat of a grazing injury, and it damaged some of her frontal lobe, but spared some of the other areas. Like if you look at the brain, there are areas back here and here that are related to language function. And so it may have damaged areas adjacent to that, but spared those. It also probably, it sounds as though it may have spared the motor areas, the areas that control her arm and leg on the opposite side of her body, because she's able to stand up. Now, the other thing to bear in mind is that, as you said, her breathing tube has not been taken out. We know she can write sentences, which is very encouraging, but she may still have some subtle problems with language that may not make themselves obvious until later on.
But you're saying subtle problems, so in terms of speaking in general, do you not think that'll be a problem for her?
So she may have some more subtle issues with speaking, like more complicated issues that we can't pick up on right now because she has breathing tubes in. But nonetheless, given how much she's recovered already and the fact that she's very young, she's only 14 years old.
Her age, that has to help.
And that is incredible, because I can't tell you how many patients I've taken care of who were children who had horrible injuries, far worse than hers, who were in ICUs for weeks to months, and then they walk out of the hospital solely because they're children, and children have this incredible ability to recover.
It's incredible. And the brain is fascinating, is it not?
Absolutely.
Thank you, Doctor. Dr. Sanjay Dhall, we appreciate it.
Thank you for having me.